Hello and welcome to the HIS annual report for 2020-21. It certainly has been a year like no other. The Health Informatics has achieved some remarkable things and all staff have been involved in that. But we continue to provide a sustainable business and we continue to connect all our patients, our relatives and our health professionals. We are truly proud of everything we've achieved.
Working in business intelligence in the last 12 months has been both interesting and challenging. We've supported the CHFT vaccination programme, setting up a booking tool which has resulted in over 40,000 colleagues, healthcare staff and patients successfully having their COVID vaccinations. We've been supporting numerous complex COVID-19 pandemic returns, providing hospital data 7 days a week and also helping the Trust understand their data to assist them in their performance and allow an effective recovery plan. We've worked closely as a team even though we've been working from home and we've been faced with daily challenges, but this has meant that we've become more innovative, use more digital ways of working and makes no day the same.
The technical response for COVID-19 over the last 12 months has been at an exceptional rate. We are now 2 years in front where we anticipated to be technically. The software adoption by CHFT staff and the health informatics staff has been at an unprecedented pace. We have managed to develop so many things that benefit the patients. We put the patient first in almost every aspect of how we've developed the technology. Thankfully we've won awards, we've been recognised nationally for the work that we've done and the time it's taken. And although COVID-19 has been probably one of the most harrowing years to remember, from a technical perspective, the advancements have been phenomenal and it's been excellent and it's been a great pleasure to be involved with it as part of the Health Informatics member of staff.
Hi, my name is Debbie Hunter and my role is Head of Service for the National Pathology Exchange on behalf of the Health Informatics Service. We have a joint partnership with XLab Limited for the delivery of the MPEG service. Following a successful funding bid, 2020 commenced with the MPEGs team focusing on more complex reporting and enhancing the infrastructure on which the MPEG service is hosted. This work set us the good foundations to respond to the COVID-19 pandemic. It was nationally mandated across England for the remaining 41 labs to deploy the MPEG service. A normal deployment can take anywhere from 6 months. We were faced with the task of deploying to all 41 labs in a matter of weeks. In addition to this, the MPEGs team were asked to be involved with the PCR testing process. This resulted in us engaging with local and national stakeholders, including the Lighthouse Labs, national NHS organisations and private companies who were appointed by the government to respond to the COVID-19 testing programme.
Hi, I'm Tahira Sharif, Digital Health Education Training and Development Manager, and I'm going to talk to you about ETD Digital e-learning. For the past year, ETD has developed ways of working to ensure staff could continue to access education and training in a safe, supportive environment during this pandemic. We adapted the education and training offers for our customers in several ways. Firstly, most of the face-to-face training was substituted by virtual delivery using Microsoft Teams. This meant larger cohorts of staff could access the training and we could continue to deliver training to the new starters and all the redeployed staff. All of the training was supplemented with the creation of online learning, including assessments. Finally, to further support e-learning, ETD created bite-sized tutorial videos which could be easily accessed by all staff.
From the 1st of April 2020, we went live with our Bradford service, focusing on specifically on the new Bradford CCG service users. We took the decision to bring the Bradford service desk into our HQ, as we had plenty of space to do this within the COVID restrictions and within the rest of the staff working at home. This worked extremely well in terms of settling the new employees into the organisation, and the service transitioned seamlessly. It was a huge success. The benefits of being on site were exactly the right decision in this situation.
2020 to 2021 has been a difficult year for people's health and well-being, both mentally and physically. Here at the Health Informatics, we've supported staff by introducing additional team catch-ups, so that whilst people are working from home and might feel a little bit isolated from the team, they're still connecting virtually and keeping in regular contact with their colleagues. We also have a wellbeing group, and through this we've introduced social events on an evening such as bingo, quiz nights and murder mysteries, so that people have some activities that they can do outside of work while we've been on lockdown. And we've also got some walking challenges, so a bit of a competition to see who can do the most steps, which will improve people's physical fitness and also encourage a bit of a competition among staff. We've also got a staff suggestion scheme, so all staff are eligible to submit a suggestion. Those are then considered by the wellbeing group and put to the senior team for approval before being introduced to the organisation. We also have several staff networks, including the BAME for our Black and Asian and minority ethnic colleagues, the Disability Action Group, and we also have the LGBTQ+ network, which I'm pleased to be a chair of. These networks are there to support our minority group colleagues as a means of support and also providing a safe space for staff.
Thank you for taking the time to listen to our annual report. I'd like to take this opportunity to thank all our customers for their continued loyalty and commitment. I look forward to working with you in 2022, making IT work for you. Thank you.